again, I'll be vulnerable. I'll raise my hand to this. Like literally everything was kind of peaking this week for me. And then somebody asked me that question genuinely and said, "Are you okay? Is everything okay?" And then that just hit the button and there was the brain sweat. It just automatically came out because my brain and my body needed to do that. And I was lucky that I was in a space where it could be held for me. I also made the decision to create a little bit of a boundary for myself to process those emotions because clearly I needed to.
Welcome to Normalize the Conversation. I'm your host, Francesca Reicherter, and today I'm joined by Dr. Mala, a psychologist, holistic healthcare practitioner, chief clinical officer at Recovery.com, and the CEO and founder of the Synergy Center. In this episode, Dr. Mala breaks down the barriers to mental health care and shares how Recovery.com is changing the game. She provides insight into finding the right support, advocating for your needs, and making mental health care truly accessible for all. Dr. Mala, thank you so much for joining me today. I am very excited for our conversation because it's something I'm so passionate about. But before we begin, I want to check in. How are you really?
Oh, thank you so much for asking that question. I'll be completely vulnerable and honest. It has been a week. I would say it has been a couple of weeks, maybe even 3 months. This year has been quite a roller coaster so far. And, like life tends to do, like lots of hurdles and, things to have to navigate. But I'm so blessed that I have a supportive work environment and an environment that is really about allowing recovery to happen no matter where you are in your recovery journey. So doing it, I'm here. I process the emotions. I am working through the hurdles and we're doing it one day at a time.
Thank you for being so honest. It's
Yeah.
amazing when you're in that space where recovery really is possible. You feel like a support system around you and to be able to take it one step, one breath, one day at a time, because that's something so many people don't have access to or don't know how to do.
Exactly. Exactly.
It took so long to be able to get to a place where I found a support system that worked for me and
Mhm.
for so many stuff that I
Mhm.
should perform. But to
Yeah.
start taking small steps in the moment and just focusing on the next step and not the whole staircase.
Yeah. I mean, we have to, right? Like, it's easy to look at the full staircase as you just said and then feel overwhelmed. But, that's one of the things that I also teach is, when you're looking at that daunting staircase, getting yourself to focus in on one step at a time is even something that your brain might resist, right? But the practice of doing that, the art of doing that is what we're trying to hone in on every day and really master as, part of the art of life. So, I'm there with everyone, working on that. So, and I'm proud to say it. So,
When we're able to recognize
mhm.
that, yeah, our brain does look at that whole staircase.
Yeah.
It's hard
Yeah.
not to. And
Yeah.
it'd be so fair for us to say to him, to like, yeah, that never moves. It's like, no, it does. And I love the way you describe it. Being
Mhm.
able to just learn in the moment. It's a work in progress, right?
Yeah. Yeah.
Acknowledge, hey, I need to be focusing on the present moment rather than separate in front of me. And also not always be able to do that. They can
Yeah.
not always gonna be one or the other, and that's okay.
Absolutely. Absolutely. Yeah. Yeah.
And that's something that I slowly had to learn in therapy. So funny that you're like, it's been a week or a couple weeks or 3 months. I honestly same to the point where 2 days ago, my therapist was like, maybe we should have sessions. Well, I still need this now just because it's
Mm.
heavy month for you.
Mhm.
And I really reflected on it yesterday after having 2 sessions this past week and how lucky I was to have access to that.
Mhm.
in the past just when I was younger, when I really needed it in the beginning.
Yeah. Yeah.
Have access to that care to be able to have someone to give me those reminders when I need it.
Mhm.
It can help
Mhm.
maybe alter my perspective and point of view a tiny bit so that I get
Mhm.
more than just the top of the terms.
Mhm.
Well,
Mhm.
helpful, and it's something that not a lot of people really have.
Yeah, no, I mean, it's so good that, you're engaging in therapy. I think it's important for all of us to have some kind of a support system that is objective like that, and we're so lucky when we can, and I'm glad, you're doing the check-ins for yourself. That was going to be my next question for you is how are you doing, I don't think we actually take the time to ask each other that genuinely, especially in a lot of work environments. It's easy to be like, hey, yeah, how are you doing? Like, okay, now on to business. Do we actually care? Are we actually stopping to pay attention to and care? So I love that your therapist came back and was like recognizing the fact that it's a rough week, month, and making that suggestion. And certainly, like, if there is the capacity and ability to do that and up those sessions, and do it, because there's no harm in it, and it'll just help you with staying grounded and utilizing a resource and a tool that clearly works for you.
Yeah, exactly. And to your point, we often don't say how are you with intention. Really
Yeah.
such breathing, and that's one of my biggest techniques, and I caught myself doing it the other day. So I
Mhm.
it's this all there, yeah, I still slip up. The was here and said, "Hey, how are you?" And I was like, "Good," and kept walking. And then I've been thinking about it nonstop since.
Yeah.
So I was,
Yeah.
but it's so important that we do stop because the times that I have stopped, right, and looked
Mhm.
someone in the eye and respond honestly and ask, like, "How are you?"
Yeah.
really made them feel like they matter and that they're,
Mattered.
and when we don't have maybe that great friend, family support system that we can talk to, or if we don't have a therapist, if we don't have something that gives us that space to feel validated, to feel heard, someone just looking in your eyes and saying, "How are you?" and
Yeah.
caring
Yeah.
really can be what helps someone take that next step forward.
Yeah. Yeah. 100%. Like, even if it's the step forward to take a moment to cry, because crying is cathartic. It's important as part of the process. It doesn't mean that you're failing or, anything. You don't have to attach a label to that act of emoting. It means I always call tears brain sweat. you know, like, it just means that your brain is processing things, and that is normal. That's, normal. That is needed. That's your body working for you. So yeah, I mean, again, I'll be vulnerable. I'll raise my hand to this. Like, literally everything was kind of peaking this week for me. And then somebody asked me that question genuinely and said, "Are you okay? Is everything okay?" And then that just hit the button, and there was the brain sweat. It just automatically came out because my brain and my body needed to do that. And again, I was lucky that I was in a space where it could be held for me, that space could be held for me. And I also, made the decision to create a little bit of a boundary for myself to process those emotions because clearly I needed to, right? So again, I'm so thankful that I can and I could, and that, that was encouraged and supported. And when you may not have that opportunity, or you may feel that finding that time is a struggle, then you start with the small stuff. You start with the 5 minutes of saying, I'm just going to take a little couple of steps back, right? I'm just going to lean back in my chair. I'm going to breathe a little bit and really come back home to myself to connect with those emotions, whatever they may be, and know where I really am. Because unless you know where you are and you're connecting with yourself, how are you going to do the work? Right. So that's how it starts. We have to give ourselves that time. Yeah.
Dude, that is so important.
Mhm. Mhm.
I don't have, if I don't feel like I have the ability in this space to support for that brain sweat, you
Mhm.
take time to reflect where I am, what I am feeling, connect with myself. I know for me, I tend to be one of those people who is very achievement driven.
That Mhm.
I'm all the time. I use it a lot of times as a distraction so that I don't always have to feel. And I've come to realize when I do that, I'm getting completely disconnected with what's going on inside of me. And the worse the like breakdowns become, the worse these depressive episodes happen, the more intense, the more frequent, because I'm not making any time to check in. And when I do spend 5 minutes in the morning or a couple minutes overhead just being quiet and still,
Mhm.
what
Mhm.
thoughts are actually going through my head and being able to recognize, like, hey, this thought pattern maybe isn't very productive right now. Where is this coming from? What else could I be telling myself? I started doing this thing before bed, a sticky note writing down 3 things that made me smile during the day and just
Love it.
jar and
Yeah.
trying to cultivate moments of connection to myself, to the world around me, so that I
Mhm.
can know where I'm at. And
Yep.
yeah, because if you don't know where you're at, how do you take those steps forward? How do you figure out what you need if you aren't connected to yourself?
Right, right. I love that. I love that exercise. You see that jar right behind you right there? I'm pointing to
Yes.
it. Got a whole bunch of okay, so they're little heart-shaped sticky notes, and my kids and I do this exercise every single day, and we're collecting them right there so that we know it's like our jar of joy and affirmations, and we do that as a family. We also do meditation together every day, so that's like a non-negotiable, but that's my jar of joy. It's sitting right there. Yeah,
Love
yeah.
that. And I love that you do it as a family because
Mhm,
a
mhm.
lot of times it's hard, I think. I'll say for my family, I'm not going to generalize every family, but for my family, it's sometimes really hard to validate and support each other because not everyone had the education and the language to be able to
Right.
offer that support, to even offer that support to themselves, to be able to check in, identify their own emotions,
Yeah, yeah.
be able to create a space within your family where you
Mhm,
can meditate together, where you can
mhm,
moments of joy and affirmations
mhm,
together.
mhm.
Also, I mean, not just helps each one of you separately, but creates that unit where you know that you are supported, where you
Yeah.
that, hey, if something is wrong, I can talk to you about it and I know that you're gonna understand and not judge. And really that is something we all need at our core is that place of validation of space to feel like we're needed, we matter, we're important, no matter how dark it might feel around us sometimes.
Mhm, mhm. Exactly, exactly. Yeah, and you hit the nail on the head, it's about sharing joy and having those types of practices so that we can reinforce those types of practices as we get older. That's what we definitely seek to do with our kids, but also holding space for them to know that they can, emote whatever they need to emote. Um, as we all know, like growing up comes with a lot of different, variables and confusions. And there's my other fur baby right there. But but yeah, I mean, we need to be able to hold that space with and for one another. And we certainly, for our family, we certainly try to do that and encourage that. Yeah.
Same because we too, were we not? It's so difficult. Being human is so well, it comes with so many emotions that I don't always enjoy. Like
Right.
like
Right.
frustration and the
Yeah.
overwhelming, the sad and the guilt and the pain.
Yeah.
Don't enjoy it. Being a human is very difficult. Being able to admit that I am going to make mistakes. I'm not always gonna know what to do, no matter how hard I try to control the outcome. I
Yeah.
control it. So
Yeah.
being able to create that space at a young age where you can learn that it's okay to be human.
Hmm. Yeah.
This like invincible superhero that never cries, feels any
Right. Right. Yeah, it's okay to be human and it's okay to be able to it's actually important to allow yourself that space to be able to be human. And I think, what our society has reinforced time and time again is that there is some kind of strength that comes with being stoic, with, holding our emotions in and, being the warrior, being the soldier, who doesn't share those feelings or admit to vulnerabilities. And, this has been one of my sayings that I've been really driving home as much as I could. It can is, there is strength in actually expressing your emotions, not in stoicism. That is not true. And there's so many, think about it, whether it's men, whether it's women, whether it's people in the workforce, um, what are we told repeatedly? That you've got to wear a mask of some kind. And that's just not right. And I want to break that stigma. I want us to know that really that strength comes from expressing yourself, from processing those emotions. So what does that mean? How do we process it when we got it? Well, we got to find care. And sometimes access to care is really hard to find, That's where the work that we do at recovery.com is just absolutely something that aligns with my own personal mission. But it's also something that the company and everything that we're doing, the company's mission is just so beautiful because what we're trying to do is enable people, no matter where you're at in your journey, no matter what you're facing, as part of your journey, to understand that there's hope, that there's education, that there's a way to connect to treatment if that's what you're wanting. So it's a beautiful, beautiful thing. One of the things that I've always tried to do personally and professionally is make sure that that accessibility to care is understood, and I'm so proud to say that recovery.com is doing that on a daily basis.
And when we have a few barriers to treatment, a lot of times falls negative in my graduate program
Mhm.
was out this stigma, which is
Yeah.
a big barrier.
Hmm.
There's also a lot of other barriers.
Right.
That financial barrier, there's structural barriers. Not a new
Mhm.
there is also close to the model has Wi-Fi bandwidth. A lot of people don't have education of what modalities exist.
Right.
It actually looks like there's so much more than just the stigma. And it's so when we talk about it, we provide education and information. We provide
Mhm.
options because one treatment option that works for someone else may not work for you.
Not gonna be, yeah. Mhm.
It might be just psychodynamic therapy once a week.
Mhm.
For me, there's a time I was in neurofeedback course medicine week. Right? It could be intensive outpatient, be inpatient, it could be residential, it could be so many different things. But if you don't know what is available to you to begin with,
Right, right.
you can begin to find what's right for you. So having accessibility on all levels is essential.
It's gonna be very important. Yeah. That's the thing that again, I'm gonna go back to the actual platform with recovery.com. What's really amazing is that you can filter to all of your preferences, so if you're looking for a specific location, if you're looking for insurance coverage or private pay, what have you, you can filter to all of that. But even beyond that, what we've really aimed to do is provide educational resources as well. And there's a lot more to come where, for that in that whole bucket. We're doing a lot of development with that, but there's tons of resources that are available already in the resource library to help you with understanding, what the journey can look like. And that's the other thing. We're going to take another kind of like a 50,000-foot view is that a lot of people hear recovery and think, oh, maybe it's about substance misuse or alcohol use or, things like that. No, 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 no. It's about all walks of recovery, whether it's mental health based, whether it's substance use based or alcohol based, whatever, it's all walks of recovery. So, and that I can't sing that song enough either because sometimes I think there's this misunderstanding with the idea of I just have depression or that person just has anxiety. We can't minimize or diminish what we're experiencing, what, symptoms we're experiencing, what conditions we have, that all of them, trauma, depression, anxiety, what have you, go through the list, requires continued recovery. And we're trying to address all of it at recovery.com.
It's so easy for us to invalidate, oh, it's just depression.
Mhm.
It's just the anxiety, or people have had worse trauma than I've had, right? It's so easy to minimize ourselves, minimize our experiences, and to assume that we don't need help, we should be able to do it on our own.
Mhm.
Because, back you said earlier, right? Society has often listed enough
Mhm.
with the ability of being strong and figuring it out by ourselves, and not letting
Mhm.
vulnerability, because that would be weakness.
Yeah. Yeah.
We change that narrative into recovery is for all of us, through
All of us.
never walk of life. It's not, there's not one criteria that makes it that you want to climb for.
Right. Right.
You need support, you want support, you deserve support. You don't have to meet this criteria of is bad enough.
Right. Right. Exactly. Exactly. So yeah, I mean, that's the other thing, where I have many specialties, but one of the specialties that I do have is looking at the lifespan. And one of the particular focuses that I've made throughout my career is addressing the emerging adult population. So anyone between the ages of 18 and 25, although I'm arguing that that's changing as well. It's not just capped at 25 anymore. And it's such a time of contemplation, where we're trying to figure ourselves out. We're trying to make a mark in the world. We're, embracing identities, exploring identities, and then re-embracing them when we figure out what they are, and trying to survive. And one of the things that I'm seeing, I think, and again, I feel so excited that we've been living in a world where advocacy and talking about mental health has become better. It's happening more frequently. But with what's going on in the world right now, I'm seeing a lot of fear. I'm hearing a lot of fear. And what I'm also seeing is a slight regression in feeling safe to ask for help again, to, research what resources there might even be to start that journey and to kind of revert back to that approach of stoicism again. So one of the things that I want to say, no matter the age range you fall in, to all the listeners, but certainly for our emerging adult population, please, 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 if you need the help, ask for the help, start that search. Know that there are many different ways you can help yourself, and also lean on other treatment centers or supportive tools to be able to create your own plan for yourself should you need to do that. But the big underlying statement is, don't stop asking for help. If you need the help, ask for the help. If you want to address what you're feeling, or you feel that need to address it, address it. Don't live in fear. Express your emotions. There's strength and empowerment to be found there.
It really is.
Yeah.
So individualized. So it's finding what's right for you.
Right.
It's okay to not be able to do it on your own.
Right. Right.
See, to
Yeah.
think we should be able to think that we should be strong enough. And being strong, at least in my opinion, what I've come to realize is that being strong for me means knowing when I need more support. I can't do it.
Right. Right. Right.
That was something that I refused to do for so long. And it made me more vulnerable in a negative way that is the innocent unit, because I didn't have that support that I needed before. But I learned about coping tools. I didn't know anything else within the these time I have medication. If I had access to something beforehand, things could have been very different. So recognizing that you don't have to figure it out on your own, and you can use different tools that work for you. Me.
Right.
therapy, maybe it's medication, maybe it's self-help books, maybe it's let's say the podcast, maybe it's coaches or spiritual teachers. Whatever mixture feels right.
Yeah. Yeah.
Do what feels right for you. Don't do something just because TikTok said you should.
Right.
It's realizing
Yeah.
you're gonna use multiple tools
Mhm.
with one tool. The point is to just show up for yourself and know that you don't have to be in it all on your own. You don't have to be stuck inside the dark place of your mind and wish that was something you learned earlier. Being at your point of emerging goals. It's such a stressful time when you cut on it.
Yeah.
Up until going to college, I didn't know who I was.
Mhm.
I love my parents. They're amazing. They also wanted to protect me, right? They
Mhm.
wanted to protect me
Mhm.
from all the changes of the world. They wanted
Mhm.
to tell me what to do to keep me safe. And then one day I had to start making my own decisions. I had to decide when I went to eat for dinner. And that became very overwhelming because suddenly I wasn't being told what to do and how to do it. I had to figure it out. I had to figure out why now it is not how I was going to spend. I don't have the choice. It was very scary. I had to learn what my actual values were.
Mhm.
When as you're becoming an adult, there was for me this misconception that I need to be able to figure it all out on my own. How am
Mhm.
I supposed to when I'm just trying to figure out who I am and how I fit in? So knowing that it's okay not to know, it's okay to get help. That's a perfect time in your life to get support, to develop a tool that you need. The entire where it just feels, at least for me, it felt like I was drowning. And
Oh,
push
yeah.
through me that life jacket.
Yeah, yeah, no, absolutely. I mean, there's so much that is thrown at you. And, when you think about, again, our society, it basically reinforces, oh, you're 18, now you're off on your own, and that is such a tender time, where we've not maybe even scratched the surface of trying to figure out, who we are. So, to everyone who's out there within that age range, like understand that that's okay, and know that beyond that emerging adulthood phase, we're always evolving. We're always continuing to grow. So don't go forth with this expectation like, oh, I figured it out and now it's done. Like that's not how that works. We're constantly evolving. Okay. We're constantly needing, therefore, to be able to connect with ourselves, to be able to understand where we're at in the present moment and listen to that. And that goes back to what you were saying. It's like, even if you are in a recovery journey, that you need to be able to give yourself that space to figure out what is it that could work for me, and maybe even allow yourself to be a little bit outside of the box and see, maybe I will try pickleball. Like I don't even know what it is, but I'm gonna try it because who knows? And if you like it, great. If you don't like it, that's okay. You've knocked one thing off your list, or maybe it's you throw a blank canvas in front of you, and you just take paint and a paintbrush and allow yourself to feel what it feels like to make a stroke of, a paintbrush on a canvas and then build from there. Give yourself the chance to explore. Give yourself the chance to connect with yourself and listen.
Be willing to try new things. Don't assume that it's not going to work.
Mhm.
It's
Mhm.
gonna work and then feel defeated when it doesn't. Know that it's said all about exploring, finding out what's right for you. I went in the high today. Was it 2 years ago?
Uh-huh.
Then. And I'm a athletic person. But I loved it because I got to
Yeah.
in a healthy way.
Mhm. Mhm.
I would just spend hours at the tennis sports. Hey, and it was so easy. And when we used to book our tennis and face bath and you could everything and everything, that was very hard.
Mhm.
Those stuff I know them. But I kept going and I got to getting this frustration and anger out in a very healthy way.
Yeah. Yeah.
It wasn't something that I was great at or didn't be great at. And I learned to love that. It is just about
Mhm. Yeah.
recognizing if I went into that with the mindset of I have to be really good at this, and then I try to swing rocket and miss the ball, that would have been for me. And you
Yeah,
keep it
you tried.
that right? Keep doing it, but don't go in that it has to work or it doesn't have to work. Like some
Mhm.
an open mind because I
Mhm.
found my well tool that helps get you a little bit further to be able to catch your breath again.
Exactly, exactly. And the thing that I also say about a lot of things, most things in life, I would say like 99% of things is that, everything that you're engaging in right now is taking you one step closer to what you're meant to be doing, meant to be in, meant to, devote yourself to. And will that shift? Probably, maybe a little bit in some cases and maybe in other cases a lot. But the point is that you need to embrace that present moment and again connect with yourself to understand what that could look like for you and how you can expand on it to help yourself right now, to be with yourself right now.
We one step closer to who you're meant to be, where you're meant to be. Things asked the other night. I don't forgot what you know, but you were talking about the theme of Cinderella.
Uh-huh.
I forgot the biggest thing says, but
I love this. It's one of our favorite cartoons in the house, so yeah.
it's just theme was midnight. Midnight's always going to come see if they're sad if you're going to enjoy the ball while it lasts, or if you're going to be waiting till midnight. For me, I said the theme was the idea of the last slipper, where there's one thing that's in the law that is meant for you and just for you. And you're going to find that thing and things are going to start to change.
Hmm.
And that was where I found hope. Right? The idea that I'm taking steps forward and every once in a while I find something that really was meant for me. And something really big changes. Maybe it's starting your own profit, right? Finding that really love us to talk about it. And now how it's about and talk about it to groups of people and it makes me feel really the
Hmm.
there's a happiness that I have for that. I found a voice within that. Or maybe finding that I like hitting things with tennis. Yeah.
Hmm.
But I'm not great at it. That's something that really helps me breathe again. So that then get to a place where I'm not just frustrated and breaking down. I release some of that energy in a way that makes me feel excited to chase after something that even in moments it makes me frustrated, I can breathe through it.
Hmm.
It's just finding what's meant for you, and for me, that all relates to the past slipper.
I love that. I love that. Well, and yeah, and the beautiful symbolism of that slipper too, where I don't know, I'm like, look at the versions, every single version, that glass slipper pretty much endures, except for when, the sister or someone like breaks it, right? There's one shoe that always gets broken in the pair. So I think that, it's very important to recognize the fragility, that is definitely there, but that you still, no matter what, have that one piece that's enduring, that is custom, that is yours, right? And you can cherish that and love that and duplicate it again to make the other two come back, whatever you need to do. But, you don't need to be worried about the fragility of it. Nourish it, take care of it, own it. That's what's going to make it be yours. And that's what will enable you to duplicate that then when and if you need to grow with you as you grow.
Yeah, because we're always growing.
Mm-hmm.
Or
Mm-hmm.
grow as life happens, you're constantly evolving and knowing that you can duplicate it and change it to adapt
Right.
to who you are.
Right.
Important and know that if one treatment option worked for you before and it doesn't work right now, that's not doesn't mean something's wrong with you. It just means you're changing and you're growing and you're evolving and you need something new. And
Exactly.
that's exciting and fun, even when it feels very overwhelming and scary. I mean that's okay. It doesn't mean again, can't this is not be yourself something I struggled with so much was convinced this isn't working for me anymore, something's wrong with me, I'm broken, I can't be helped. But that
Mm-hmm.
was, it's I got all that like out of this. And
Right.
yes. had new experiences as I've grown and changed, I need something new. And that's there's a lot of adventure and unknown and uncertainty, which in that boy's very way. But
Yeah.
I find something else and explore the piece of myself.
Mm-hmm.
We grow, we evolve, and that's beautiful, even if it feels very scary.
Right. It may feel scary, it may feel daunting. It may induce fear. But what's fear? What's anxiety? It's your neurons firing, trying to warn you that something might be wrong, or to consider where things might be wrong. That's not a bad thing. You know, I want my brain to do that. I don't want to live in it though, right? And that's the thing that I also teach. We need to learn to make fear and anxiety our friends instead of our foes, because ultimately what it boils down to is our brains trying to protect us, right? So listen to it, acknowledge it, you know, and then ask yourself, okay, I acknowledge the fear, I acknowledge what feels daunting. What is it that I actually want? Right? Acknowledge what you want. And then let's do a comparison, because that fear is actually telling you what you are wanting, right? So then acknowledge what you want and then move on to action planning. And when you look at the action plan, go for the big picture, do the long term, because then what we're going to do is, or what I want you to do is action plans down to that shorter term goal, right? The lowest hanging fruit that you can do here and now today that ultimately is taking you down the path of being closer to that big eye in the sky goal. And then ask yourself, how am I going to be accountable with and for myself? Does that mean that I'm keeping a chart? Does it mean that I've got an alarm or a timer, a reminder in my phone? Am I choosing an accountability buddy? All of these are good options. So it's what I call the 4 A's. That's the process. Acknowledge what it is that you're fearing or that's bothering you. Acknowledge what you want to have happen. Action plan, short to long term, and then choose your accountability. How are you going to be accountable with yourself, for yourself, and are you choosing an accountability buddy to do this with you, or to help you?
That's genius.
Thank
Yeah.
you.
That actually letting that little for just short term, that goes back what we were saying in the beginning, right? That's there. Where
Yeah.
up today because it's so easy to get so focused. We set goals, but kind of time to set those really big goals, which are so
Mhm.
exciting.
Mhm.
But looking at that whole staircase and feel daunting. So
Mhm.
that was what you can do today in this very moment that feels safe and reasonable. Right?
Mhm. Mhm.
That makes you feel good. That helps you
Mhm.
in the direction that's right for you.
Yeah.
And vulnerability so quiet because I'm so aggressive in that just up on that. So I am just thinking full face and meeting.
I'm right there with you. I've got my planner right here. You can see the corner of it. That's got my to-do list. Yeah.
But not for those things I belong to. Not for those things I send to other people to respond of like, hey, should you me today? And ask me if I did that. Not to one yet because I love to make a list of things I need to do. I love to come up with all these great ideas.
Mhm.
I'm always accountable to myself, even if I make a list. I like crossing things off a list, so sometimes I just end up adding more things that I did instead.
Mhm.
So I can just text and say like, "Hey, check in with me when I did this." It's been really vocal, and maybe it's like you said, adding it to your calendar, setting an alarm, telling someone else, finding ways to be vulnerable is
Mhm.
important because creating all these goals and these action steps are amazing. So then we follow through. At least for me, the follow through can be the most daunting part. And
Mhm.
it's all the work leading up to it. I'm like, did you do this too? Having that sense of accountability has been so helpful. But as we are wrapping up, what is one last piece of advice you'd like to leave our listeners with?
I'm going to go back to exactly what I said in the middle, which is please, please, please remember that the expression of your emotions will only empower you further. Please hold space for yourself. know that asking for help is a good thing and that there's a lot more accessible to you than you might think there is. Certainly, recovery.com can help with that, but whatever is in your close proximity as well as the website, talking to a friend, talking to a coach or a therapist, talking to a mentor, talking to a parent, all of this, please keep doing it because, definitely you're not alone. Um, but there's so much out there that you can embrace and create for yourself to help you with embracing that recovery journey that you need to be on.
Thank you so much for listening to Normalize the Conversation. Don't forget to subscribe, rate, and review. This podcast is an initiative of Inspiring My Generation, focusing on normalizing the conversation, bringing education and awareness to the forefront, and amplifying global voices to spark change and hope. Inspiring My Generation is a 501c3 nonprofit organization on a mission towards suicide prevention through awareness, conversation, education, and support. Connect with us on Instagram at Inspiring My Generation and visit our website inspiringmygeneration.org to learn more about our work and how you can make a difference.